Bismillahirrahmanirrahim. The first case, Mr. Hamid is 65 years old. He has been admitted 1 week back because of right-sided weakness after a stroke. Now he's complaining. He's complaining of bit sores, and a swab done for him revealed that he has MRSA. His son is very angry that his father was admitted without bit sores and he developed bit sores at the hospital, and he wants to discuss this issue with you. You are senior officer of the medical department. You are asked to discuss this issue with Mr. Ahmad, son of Mr. Hamid. Here we have two dilemmas. The first dilemma is the medical negligence for the patient that he developed bit sores. Second dilemma is explanation of MRSA for the relative, what's MRSA, and the management plan for MRSA. Dr. Royal now is going to write his headlines that he's going to discuss with the patient.
هو الصن اسمه ايه يا دكتور صادق؟
Mr. Ahmad is son of Mr. Hamid.
مستر احمد.
Dealing with medical negligence, how to manage medical negligence, approximately the same for all the cases. Plus here you are going to discuss what's MRSA and how to manage MRSA to deal with this patient.
في تمرين كده زي الضغط شغال حاجه انت
Okay, I'm ready, Dr. Saad.
Okay, first I want to welcome the new candidate for attending without for the first time, Dr. Ahmed Sulaiman, Dr. Dr. Muqis, but I think Dr. Muqis attended with us before. Dr. Ismail Drus. But Dr. Ismail, I think you went to the exam to England soon, isn't it? Dr. Ismail? I don't know if he
شكرا يا دكتور كتر خيرك.
Dr. Ismail, I think you went to the exam to UK in, last week, or maybe I'm wrong. Okay, Dr. Al-Wizq Hassan, Dr. Hassan,
دكتور الواثق.
Al-Wasq Hassan.
الواثق.
Yes. This is the first time also for him to attend our discussion.
Yes, this is first time.
Dr. Ayan also the first time. Welcome all.
انت سامعني يا باشا؟
Yeah? Okay, Dr. Wael, are you ready? Dr. Wael?
Yes, I'm ready, Dr. Saad.
Okay, we can start.
Okay. Good morning, Mr. Ahmed.
Good morning, doctor.
Dr. Wael, senior house officer in the medical department. Nice to meet you.
Nice to meet you, doctor.
Mr. Ahmed, you're the son of Mr. Ahmed.
Yes, doctor.
Yes. Okay, Mr. Ahmed, can you tell me what you know about...
Your voice is interrupted, Dr. Well. Yes, doctor, I know that my father was admitted last week in your hospital because of a stroke. And now, doctor, he's developing bed sores, doctor. And I want to know how my father to develop bed sores in your hospital, doctor. Suppose that my father is coming to be treated and to have the full care despite that he has bed sores, doctor.
Mr. Ahmed, as you know, your father condition time in our hospital, and this time.
Dr. Wael, there is a lot of interruption in your voice. Dr. Wael? Hello?
Please. Hello?
Okay, we can manage.
Okay. Ahmed, your father has stayed in our hospital for a prolonged period, and this complication could happen with the patient who stayed.
Hello? Yes, doctor, yes. But so my father stayed for 1 week in the hospital, but suppose that my father has to receive the full care, not to develop any complication at all in the hospital, doctor.
Yes, I understand that, Mr. Ahmed, but due to some sort of negligence from our team, he was not changed his position during the recumbents in bed every now and then. That's why he developed bed sores.
And why, doctor, you didn't reposition him? This is your rule, doctor, to give the full care to the patient, to reposition him, not to develop any bed sores at all.
Yes, this is our job. Yes, I understand that, and I'm going to make a full investigation about that problem and seek who is for that. And we are going also to inform my consultant and the head nurse in the department to investigate this problem for you.
So, doctor, what you are going to do regarding that?
For this bed sores, Mr. Ahmed, we are going to manage your father. As you know, lines of management of this bed sores is regular hand washing by the staff who is caring for your father, and to give him as a proper antibiotic which can help him with healing of this bed sores.
Yes, doctor, what about this negligence? What you are going to do toward this negligence, doctor?
We are going to write incident report to Mr. Against, and this will be fully investigated, and we will inform you about the result of this investigation as soon as possible.
Yes, doctor.
Mr. Ahmed, we are going to manage your father bed sores. We are going to recommend for him a regular hand wash by the staff looking time, and also we are going to prescribe for him the proper antibiotic, and we hope this bed sores will be managed quickly.
Yes, doctor, I knew that also there is an infection in the bed sores.
Yes, he was in spit sores. We found it is infected by a bug called MRSA. Have you heard about this bug before?
No, doctor, this is the first time.
Yes, it is a bug called methicillin-resistant Staph aureus. This bug is resistant to the ordinary antibiotics. So we have to give a special. If it is not serious, if it's not treated, it could be serious. It could lead to serious complication. It can affect his organs if not properly treated.
Yes, doctor.
Okay. So we are going to provide with him treatment. And can you tell me, Mr. Ahmed, what your father work?
Yes, he's retired, doctor, for the last 5 years.
Okay. And he is living alone?
Yes, doctor is living alone. My sister is living in Nerby with him, and she is taking care of him.
Yes, he can manage his daily activities.
Actually, doctor, he was doing well before developing this stroke, but I think now he will be completely dependent, doctor.
Yes, we can provide him with a social worker in order to see what his needs and to help him with managing his daily activities.
Yes, doctor.
And also we can if he have any financial problems, we can provide him with financial support for his for in order to help him with his managing his needs.
Yes, doctor.
Okay, is he your father is he a smoker?
No, doctor, he don't smoke at all.
Does he drink alcohol?
No, doctor.
Okay. Does your father drive, Mr. Ahmed?
He was driving before, doctor.
But now he's not driving?
Now he's admitted in the hospital for the last 1 week, doctor.
Okay. If you want to return to driving, I think you have to inform the DVLA about his condition. Okay, Mr. Ahmed?
Yes, doctor.
Okay. Can you tell me what's your concern, Mr. Ahmed?
Yes, doctor, I wanted the name of the nurse who was responsible for my father, doctor, to complain here.
You know, we are working, Mr. Ahmed, as a whole team who are responsible for your father's condition. There is no one by name who is looking for your father. So if a fault happen, this is a team mistake, not a single person mistake.
Yes, doctor. Are you defending your colleague, doctor?
No, I'm not defending my colleague, but you know, if we find that someone is responsible for your father's mistake, we will punish him. But as I told you, we are a team. There is a teamwork who are looking for your father's condition.
Okay, doctor, I want to do a complaint, doctor.
it's your right, Mr. Ahmed, to make a complaint. And if you want to make a complaint, I can I give you a complaint form, and I can send you to the patient advice and liaison service, who will investigate your complaint and will inform you about the result of your complaint as soon as they know.
Yes, doctor.
Okay. Do you have any other concern, Mr. Ahmed?
No, doctor.
Okay. I will give you my contact number. If you have any inquiry or any question, you can about your father's condition, you can contact me at any time.
Yes, doctor.
Okay, is that okay for you, Mr. Ahmed?
Yes, doctor.
Okay, thank you, and nice to meet you.
Thank you, doctor. 10 minutes. Still, you have 4 minutes. If you want to do anything else.
أنا خدت بس 10 minutes.
10 minutes, yes. Or 11, maybe 11 minutes. Okay, discussion with the examiner. Doctor, do you think that you convinced the relative about this medical negligence, doctor?
Well, for the time allowed to me, I try to do my best in order to convince him about the complication which happened to his father, but I also told him that we are this. I apologize for this negligence, and also I informed him about the management lines which are going to do in order to correct this complication.
Yeah, and how are we going to investigate this medical negligence, doctor?
We are going to look for who is responsible for the caring of his father, and we are going to write a report about that. And if we find someone who is responsible for this mistake, we will punish him, and there will be a committee composed of the consultant and the head nurse who will investigate this problem.
Yes, doctor. What about MRSA, doctor? Did you convince him, and did you explain everything about MRSA for him?
I told him that effective measure for controlling this type of infection is regular hand washing by the staff looking after his father, and the nursing are following these rules right now, and he will receive the proper antibiotic which can help to control this infection.
Yes, doctor. Okay. What the ethical issue here?
Ethical issue here. For the ethical issue here is patient have the right to know that what sort of complication happened to him, and he have the right also to know the management plan for this complication, and he decide what kind of treatment he can take. This is for the patient autonomy. For beneficiaries, we are acting in best interest for the patient, and we are doing our best to control this infection. For normal patients, we will not harm the patient. For justice, I think every available resources will be given to his father in order to help him to control this infection, regarding of his race or religion or anything.
Yes. Okay, thank you, doctor.
Thank you.
Thank you, Dr. Rael.
Yes.
Open discussion. Anyone has any comment? Anything you may be missed from Dr. Rael?
بس في الأول دكتور صادق
First,
Yes.
if you study about bed sores. Bed sores here considered as a negligence or considered as a normal complication from the case. In this condition, we have to consider it as a negligence.
Yes, Dr. Magid,
Or
as a
normal
negligence
complication.
because, the patient developed bed sores in the hospital. This patient has to receive the full care and to be repositioned from time to time by the nursing team. So, of course, this is medical negligence.
Air mattress should be considered in the bedridden patients. Should be put in a air المرتبة الهوائية.
Yes.
Air mattress.
Whatever
Should be put in
the
this
patient.
case.
If the patient develops bed sores in the hospital, this is considered to be negligence. Yes.
I have another comment of the word our colleague said in the discussion. He said that we are going to dig down to know who is responsible and punish them.
Yeah.
I think I have to use the word punish.
Yeah.
I think we have to deal with the situation properly according to what happened, and we are going to discuss that with them and deal with the person who is responsible for the mistake. I think so.
How we are going to overcome or to make investigation, Dr. Nagla, for this medical negligence? Dr. Wael already said that we are going to make incident report. Okay, I agree with him. Anything else we are going to do?
Yes, I have to regain first the situation that the patient came in with. We have to be sure that he didn't have a hidden ulcer and we didn't recognize it. We have to ask the responsible one who examined him at first, and then we are going to reassess who was responsible for him. It was one nurse for every day, or they are shifting from each other. And according to the sheet that they are giving to each other in each shift, we are going to know who is the responsible when it happens. It's very important.
Yes. What else we are going to do to convince the patient that we are going to make detailed investigation about what happened? What other actions?
We will give him promise this will not happen.
Yes.
Dr. Sagar?
Yes, Dr.
We will not
We are
give
going
him,
to
we
do
will
a
give,
report.
we
Incidental
will give him
report.
promise. We will give him promise that will not happen again for other patients. Yeah.
Yes. What is the internal investigation the hospital we are going to do?
We are going to do an incident report. This will make the team who is responsible for geography.
Yes,
Yes.
morbidity and mortality meeting.
Uh,
We'll discuss
Incident
this
report.
issue in morbidity and mortality meeting to avoid to happen again in the future. What else?
involving الانفكشن كنترول ديبارتمنت بقى.
This is in the management that we are going to do multidisciplinary team from infectious diseases and plastic surgery to give him the full care and daily dressing for healing, early healing. Okay. What else investigation are we going to do? Risk management team. We'll discuss this. We will refer this issue also to the risk management team to discuss what's happened and to investigate what's happened exactly to the father. And we'll inform consultant in charge and nurse in charge about what happened to your father. So here 5 actions has to be done. First one, incident report has to be written. Second, to inform the consultant in charge and nurse in charge about what happened. Third, to discuss this issue in the morbidity and the mortality meeting to investigate what happened exactly to avoid that in the future. Fourth is risk to discuss this issue or to refer this issue to the risk management team also to be investigated. And then to apologize so much about what happened to the father. I agree with Dr. Wael that we don't have to say that we are going to punish the one who is responsible for this negligence. Okay, so the headlines of this case would be as at the following. Number one, apologize for what happened to the father. Apologize so much. And admit that what's happened is something wrong and there is a medical negligence. Number two is to discuss with the relative what you are going to do regarding this medical negligence. The 4 actions we, like we said before, incident report, informing the consultant in charge and nurse in charge, to discuss this issue in the morbidity and the mortality meeting, and to refer this issue to the risk management team. Is it alright with you, Mr. Ahmed? And you have to be reactive with the patient, that the patient is, to be sure that the patient is convinced for what you are going to do for his father. And then to discuss MRSA, and how you are going to manage MRSA. This is the headlines of our case. So for me, if I'm going to present this case, after asking him open question, how much do you know about your father's condition? Of course, the relative would be very angry for what happened to his father and the bad sores that developed in the hospital. Apologize for him. I'm really sorry for what happened to your father. I appreciate your feeling, and I know that how much your father is precious for you. And be sure that we are here to help your father as much as we can. So, what we are going to do to avoid that in the future is to write instant report about what happened to your father, and to inform the consultant in charge and nurse in charge about this incident, and to manage and to investigate what happened to your father in the morbidity and the mortality meeting, to avoid that to happen in the future, and also to refer this issue to the risk management team to be investigated seriously, not to happen in the future. Is it alright with you, Mr. Ahmed? Again, apologize. I'm really sorry again for what happened to your father, and be sure that there may be some breaking of the communication or misinformation, and that should be investigated seriously. Now I'm going to explain for him the MRSA. Your father, big sores also, unfortunately, is infected with one germ called MRSA. Have you ever heard about this MRSA before? No, doctor. Okay, MRSA is one type of the germs. There is a germ called the Staphylococcus aureus. This germ is a normal habitant of our nose and the skin of the normal people. But sometimes if the patient is debilitated and the patient is immunocompromised, it can be infectious and making serious complication. Actually, this type is resistant to a lot of types of antibiotics. So what we are going to do, now I explain the MRSA. What we are going to do to your father is to refer him to multidisciplinary team from infectious control doctor, plastic surgery doctor, and to make daily dressing for his wound, and to give him the proper antibiotic to eradicate this germ for early cure and improvement. Also, your father needs isolation in a special room, not to infect the others. He also needs special care, like washing of the hands, wearing gloves and gowns, to avoid to infect the others. And also, when there is a visit to your father, anyone has to wash his hands and to wear gloves and gowns, not to transmit the bugs or the germs to anyone else. this is quickly and easy review of the case. So any case of negligence, medical negligence, otherwise patient develop maybe allergy to antibiotic or allergy to codeine, for example, it will be the same. Apologize for what's happened to the father and informing him that we are here to help his father as much as we can and to give him the full care. Then give him the actions you are going to do regarding this negligence, regarding writing instant report and informing the consultant in charge and nurse in charge to discuss this issue in the morbidity and the mortality meeting, and refer this issue to risk management team. Yes, someone is going to say something?
Yes, Dr. Sadiq. What about social history in this case? Is it right to ask about the social history?
Of course, very important, yes. Social history,
how to ask
alone, Dr. Wael, he dealt with the social history very good. So if your father is living alone, we can, if he is going to be discharged, we can offer him social work. We can refer him to social work to give him to solve any social problems, and we can provide him with a special nurse who can give him the full care at home.
But in this situation, the father is admitted to the hospital.
Yeah.
What is the benefit of asking out? Is he a smoker or alcohol, and with whom do you live? I think.
Yes,
or
very
it is
important
a
to ask
scheme
about the social history,
follow.
Because the patient may be living alone, so that you are going to discharge the patient. So you have to be sure that with whom the patient is living and who is supporting the patient at home, so that when you are going to discharge the patient, to know who will give the patient the care at home. Regarding smoking and alcohol history, can take this history also. Alcohol can cause immunodeficiency also for the patient and worsen his condition. Also alcohol and smoking.
Thank you, Dr. Sadiq. Thank you.
You're welcome, Dr. Rami. Any other comment?
About precautions for the visitor, you said wash your hands and the gloves, okay?
Wearing gloves and the gowns, yes.
Gowns, yes, and gowns. About the precautions for the doctor and the nurses deal with patient. Is there any special precaution for doctors and the nurses deal with patient?
Dr. Magid. Also, the nurses will have to wash their hands and to wear gowns and gloves and wash their hands after contacting the patient to avoid transmission of the infection from one patient to the other.
About MRSA, Dr. Sadiq, about MRSA, yes. The surrogate asked the doctor, is it a serious disease? Doctor said to him, it is a serious disease. But MRSA, as in bed sores, I think I read before, it is not a serious condition, and it has a very good prognosis, and even not need for strong precaution for MRSA. So I think it is not serious disease. It is not serious condition.
Actually, Dr. Magid, can be serious if untreated. This is a logic reply, actually, because
we isolate. The policy in the hospital is to isolate MRSA patient.
Yes.
The policy in our hospital is to isolate MRSA patient.
Yeah, and we mentioned that in the management plan, actually, that the patient has to be isolated in a special room. But MRSA, Dr. Magid,
and the infection control team is following up the condition.
Yeah. And to refer the patient to a multidisciplinary team from infection control plus surgery also are involved to make daily dressing and to receive the proper antibiotic to guarantee that he will has the full care and the early improvement. Can be serious, Dr. Magid, if untreated.
Okay, thank you, Dr. Thank you.
One more comment, please, Dr. Sadiq.
Doctor, who is talking?
محمد النجار. ازي حضرتك؟
Dr. Muhammad Nagar, you are welcome, man. Yes, أهلا بك يا Dr. Muhammad.
One more comment regarding the precautions and management of MRSA. Maybe also covering the wound. The wound should be covered, and also the washing, the clothes washing and bedding should be washed in separate as well.
Yeah.
And regarding the isolation, it is very important if the patient stays in the hospital. But if the patient is transferred to a residential house, for example, there's no need for isolation.
Yeah.
But special precautions should be followed.
Yeah, I agree with you, Dr. Muhammad. We are here not discussing the detail. It is not our task to talk about MRSA and its precautions and management. I know this case mentioned in Rider as but the target and the goal of the case was MRSA. There is a lot of precautions actually, like if the patient has eczema or something, or allergy or something like that in his skin, he has to avoid contact with the patient, or psoriasis, for example. Okay, there is a lot of details about MRSA precautions and management, but we don't have to mention here because this is not our main task. Our main task here to manage medical negligence and to give hints about MRSA and management, the headlines of management and the care about MRSA. Not all the details actually. But if your task is to deal with MRSA patient, of course you have to mention all the precautions and management of MRSA. If this is your main task. Our main task here is to deal with medical negligence and with angry patient. Okay, any other comments here?
Okay, thank you, Dr. Sam.
You're welcome, Dr. Muhammad. Any other comments? Okay, the next case will be with Dr. Ahmed. Dr. Ahmed, are you there?
history ولا communication?
اتفضل يا دكتور صالح.
It will be communication also.
Okay.
Mr. Osama is 50 years old. He has been diagnosed to have cancer lung with metastasis 2 days back.
Would you please, doctor, would you please mute the mic? I don't hear clearly. Our colleagues, please mute the mic.
Just kindly the other candidate to mute the mics and to open the mic when there is open discussion, because there is a lot of echo. Mr. Osama is 50 years old. He has been complaining of cough and loss of weight for the last 12 months. And he has been diagnosed to have cancer lung with metastasis. Dr. Ahmed, are you there?
ايوه دكتور صادق اتفضل.
And the blood investigation done for him and the CT chest and the diagnosis of cancer lung with metastasis has been confirmed to his condition. For your kind care. We can continue. We can continue our case or the scenario that Mr. Ahmed is very angry that he seek the medical care for his GP 1 month back, and only chest X-ray was done, and his the GP prescribed for him some medication only, and he is very angry that he has this delayed diagnosis.
دكتور صادق معلش انا اسف عشان كان في انتربشن بس في الصوت. هو مستر أسامة 50 years old complained cough and loss of weight for the last 1 month. وكانسر lung with metastasis diagnosed. إيه الباقي بقى؟
Yes, he seeked medical care for her GP 1 month back and only chest X-ray was done and he gave him some medication only and he is very angry for this delayed investigation, for this delayed diagnosis. Also, this is one of the difficult cases coming in the exam. Angry patient for delayed diagnosis. I don't know, there is some noise.
It looks like that someone
is sleeping. Someone is sleeping. Someone is sleeping, yes.
It's very early to sleep.
Yes. Someone is...
Maybe our voice make the people to sleep. Okay, Dr. Rael, as well for your case, also you didn't do summary for the patient. That's why you finished early. Try to do summary for the patient also for the important points you discuss with the patient. Okay, to make your case is perfect and there is no deficient time.
But Dr. Sadiq, if I have time, okay, I already asked about the concern. I will summarize and then check understanding.
Yes.
But if still I have time, if there is any rule for this, or just I will tell the examiner that I had finished.
If you have time, you have to summarize and to check understanding. If you don't have time, it's okay, no need. It is not of so important to summarize and to check understanding, but you know, to make the case perfectly, I think you will have time for that. I mean, if you miss this summarization and check understanding, it's okay. The examiner may overcome this one, but if you miss the concern, he will not overcome this point, of course.
Yes.
Okay, Dr. Sadiq.
Okay, we can start.
Good evening.
Good evening, doctor.
I am Dr. Ahmed Adil, the medical doctor in a respiratory clinic. Are you Mr. Osama, 50 years old?
Yes, doctor, I'm the one.
Nice to meet you, Mr. Osama.
Nice to meet you, doctor.
Mr. Osama, we are now to discuss your condition and to reply to any concern you may have for helping you. Is it alright with you to discuss this today?
Yes, doctor.
Okay, do you want anyone to attend this meeting?
No need, doctor, thank you.
Okay, Mr. Osama, can I know how are you feeling now?
It's okay, doctor, I feel better than before. Thank you for asking.
Okay, Mr. Osama. Mr. Osama, can you tell me what do you expect about your condition? What had the doctors told you about your condition?
Yes, doctor, I have been complaining of this cough and loss of weight for the last 1 month, doctor. I seek medical care before with my GP and he did some imaging for me called X-ray. He told me it's some sort of infection, maybe. He gave me some medication, doctor. But my condition was not improved at all. That's why I seek medical care for your hospital, doctor.
I am sorry for that, Mr. Osama. Can you tell me what do you expect about the new investigations that have done for you?
No, I'm not sure actually, doctor.
Okay. Mr. Osama, I am sorry to tell you that the investigations that have done for you, including the imaging and blood tests, have been released, but these are not as we hoped.
What do you say, doctor? Is there something serious there?
I am sorry to tell you, Mr. Osama, that the investigation is showing that you have a cancer in your lung. I am very sorry for that.
Oh my God. Are you sure, doctor? My GP told me just 1 month back there is nothing, just some sort of infection, doctor. How dare you?
Make sure, Mr. Osama, that I am here to help you and I will reply to any questions you may have. I appreciate your feeling. I will do the best for you. I am sorry to tell you this bad news today. I know that this is upsetting for you to hear this today.
Yes, doctor. So that why my GP told me that it's only sort of infection, doctor.
Mr. Osama, I didn't know the details about what had happened. I am now to help you, but I hope to tell you that in our work in the medicine, all investigations may have some risk of misdiagnosis any disease. All investigations are not diagnostic by 100% of any condition. So your condition may be misdiagnosed by your GP. I am not in a different situation, but I want to explain to you the situation.
Yes, doctor. So that's why he didn't prescribe for me, or he didn't make any other investigation. Also, doctor, like the CT for my chest, doctor.
Many diseases may resemble each other, Mr. Osama. He may be expected that is a type of infection, so he didn't ask for that. But I will contact your GP and I will know the details about this and will discuss the issue with you. And I am concerned now about your condition and the management plan for you.
Yes, doctor.
Okay. I am sorry to tell you, Mr. Osama, that the investigations, as I said to you, is showing that you have cancer. In addition to this, cancer is spread to other organs. I am very sorry for that.
Oh my God, doctor, there is a spread as
but
well.
We will
So
do our
if
best.
I diagnosed 1 month back, I can have the management plan, and maybe I would have the full cure, doctor, if I diagnosed early.
I appreciate your feeling, Mr. Osama. I will help you as much as I can, and I will discuss this issue.
Yes, doctor.
I know that you have the right to be angry, as I see. This is upsetting for you. But I promise you that I will discuss this with your GP.
Yes, doctor.
Okay. Mr. Osama, do you know the management plan of your condition?
Yeah, is it curable condition, doctor, now?
I am sorry to tell you, Mr. Osama, that your condition is already advanced, but we will do our best for helping you to make you as comfortable as possible. So we will refer you a multidisciplinary team from tumor doctor, McClinian nurse, occupational worker, and occupational worker, social worker, and psychiatrist to help you and give you the proper plan of management. And the management plan will be discussed in more details with this team.
What could be the management, doctor, for this cancer?
The management details will be discussed with this multidisciplinary team. This may be in the form of palliative treatment, in the form of painkillers and supportive care, in the form of good nutrition and treating any infection if present, and if there is any more details about this treatment, this will be discussed with the multidisciplinary team.
Yes, doctor.
Okay.
There is no hope, doctor.
I'm sorry to tell you that your condition is already advanced, but we will do our best for you as much as we can for helping you, Mr. Osama.
Yes, doctor.
Okay. Mr. Osama, can I know what is your work?
Yes, doctor. I'm working as taxi driver, doctor.
And how much your symptoms affects your job?
So much, doctor. I feel fatigued recently, and this cough is irritating me so much. I can't work like before, doctor.
I am very sorry for that, Mr. Osama. We'll refer you also to a professional physician within the multidisciplinary team, which will help you regarding this issue. What about your daily activities?
Also not like before, doctor. I feel so bad, doctor.
I'm sorry for that, Mr. Osama. Also, social worker will help you regarding this issue, and will be with you all the time for helping you. With whom are you living?
I'm living with my wife, doctor.
Is she doing well?
Yes, doctor.
Okay. Are you financially supported?
Yes, doctor.
Okay. Are you smoker or drinking alcohol?
Yes, doctor. I smoke, doctor.
You have ever thought about stopping smoking?
No, doctor. I didn't try at all.
I can help you by referring to a smoking session clinic if you don't mind, Mr. Osama.
Why, doctor? There is cancer already. So what? Stop smoking. What will do for me?
So smoking cessation can help any person. It is not good for life anymore, Mr. Osama, even if you have cancer.
Yes, doctor. I'll think about it.
Are you drink?
No, doctor.
Okay. Are you drinking alcohol?
No, doctor.
Okay. Mr. Osama, I am sorry again for the bad news that you are hearing today. But we will do our best for you and refer to the multidisciplinary team. And I will also involve your GP to discuss the condition with him and about what had happened. And I may also involve my consultant to take his opinion about what had happened. And I will give you the outcome of this discussion. Can I know now what is your concern?
I want to do complaint against the GP, doctor.
Okay, Mr. Osama, you have to do this complaint. I will give you the details of how to do a complaint, and your complaint will be investigated, and you will be given a result about this complaint after some time.
Yes, doctor.
Okay, Mr. Osama.
Yes, doctor.
Any other concern?
No, thank you, doctor.
Okay, Mr. Osama, I had told you about your condition today, but make sure we'll do our best for you to help you and make you pain-free. And I will give you also my contact number to call me at any time if you have any worries or questions. Any other concern or questions, Mr. Osama? Anyone to drive you home?
Yes, Dr. Mark is coming.
Anyone? Okay. Nice to meet you, Mr. Osama. Thank you.
Nice to meet you, doctor. Thank you. Okay, this discussion with the examiner. Doctor, do you think that you convincing the patient about what's happened to with his GP, doctor?
According to my time, I try to situation for him because I
Rahmat, the voice is interrupted from your
try to explain to solve the problem
Okay. Okay, you can proceed.
According to my time, I tried to convince him about the possibilities about what had happened because I didn't know the certainty about the condition, and I promised him to investigate the condition and tell him about the result of that after involving the GP and the consultant.
Yeah, do you think, doctor, this is medical negligence that has to be investigated?
Any investigation has some form of causes.
Yes.
So the condition may be misdiagnosed.
So is it medical negligence or not?
I don't know.
Okay, what's the escalation with it?
Physical issues, autonomy, the patient has the right to share information and management plan about his condition. Belief chance is to do good for the patient and non-belief chance not to do harm for the patient. And justice that the patient should be treated regardless of his religion, race, thoughts, or color.
Yes, doctor, thank you. Doctor.
And also the ethical. Okay.
Okay, very good, Dr. Ahmed. We did the case perfectly, actually. So, let's do open discussion about this case. Anyone has any comment?
I want to be sure, doctor. He offered him somebody to drive him home or bringing him a taxi.
Yeah.
I didn't meet it. The sound was interrupting
anyone
me.
to drive you home.
Yes, okay.
I want to give a comment regarding the smoking.
Yes,
There is no need to stop smoking in terminal cases like this. So there is no need to refer the patient to the smoking cessation clinic because already he presents with metastasis. The other thing is that in terminal illness like this, maybe we have to ask the patient about any living will or advanced directives as well. Yes. Thank you.
Thank you, Dr. Muhammad. Anyone want to add anything else? Okay, Dr. Nagar, let me ask you what you think about presentation of Dr. Ahmed.
Well, Dr. Ahmed actually he did it in a very good way, especially that he didn't push the patient to make a complaint against the GP. Until after the patient has already asked to submit a complaint against him. So that was a very good point. Regarding the question, which is is this a medical error or not, I'm not really sure, but I would say yes. I'm going to investigate further. I'm going to make an incident report.
Yeah.
Yes.
Do you know what's happening at this time? What was your symptoms and what was your finding? So we can't decide this is medical negligence or not until investigation to be done and contacting the TB
exactly,
GP and reviewing the patient all the file. As Dr. Ahmed said, many diseases may mimic each other, and the symptoms of cough at that time can be presented by many diseases like infection, like as the GP decided at that time. I don't defend my colleague at all, but I'm clarifying for you what would be what might happen in this time. That your symptoms may mimicking other disease, because a lot of disease has the same symptoms. So what we're gonna do is to contact the GP and to know what were your symptoms at that time, and also to review your old file to know what was going on at that time, and to see what investigation done for you, and if there any positive data indicating to do further investigation or not. Maybe at that time there was no indication at all for another investigation, and your condition was stable So this is not a case of medical negligence like the case before, actually, because many cases can have misdiagnosis, because as many symptoms may mimic each other, or many diseases may mimic each other in the symptoms, or similar to each other. So we can decide it is medical negligence after investigation to be done. Maybe the chest X-ray was normal at that time, and Dr. Ahmad can give you the scenario that the chest X-ray was normal at that time. So this can facilitate for you the case more, that your chest X-ray was normal at that time, so that there was no indication at all for another investigation to be done, and there is no alarming symptoms indicate us to move treatment. Okay, this is a simple case of breaking bad news, but there is other dilemma in the case plus breaking bad news. The dealing with angry patient for delayed diagnosis. And this delayed diagnosis, you have to explain for the patient why this delayed diagnosis. We don't know what were your symptoms at that time, and what was your condition at that time. So what we gonna do for you is to contact the GP and to review your old file and to inform the consultant about what happened. I'm not here to defend my colleague, but be sure that we are here to help you as much as we can, and we are going to do our best for you. And we are going to inform you about the result of this investigation. Of course, like Dr. Nagar said, don't push the patient to make complaint. Don't say for him, you have the right to make complaint if you want. But if the patient asks you to do complaint, it's okay. Then you have to reply him, you have the right to do complaint, and I'm going to refer you to the patient advice liaison office, and we are going to follow up your complaint. And be sure that regardless the result of the complaint and regardless your complaint, you are going to receive the full care. Why this sentence? Very important to explain for the patient. There will be no discrimination at all against him. Some patient may be, afraid that if they did complain, they are not going to receive the proper treatment, and you will be discriminative against them. So be sure that regardless your complaint, you are going to receive the full care. Dr. Ahmad, you can give him hints about the treatment. The treatment may be in the form of chemotherapy through a needle by courses, or maybe by radiation, but the management plan in details will be discussed with the treating team.
طب السؤال بتاع السموكينج يا دكتور صادق.
Yeah, Dr. Nagar has his right in advanced case and case with cancer with metastasis. No need to stop smoking for the patient as no benefit at all.
تمام.
Okay, any other comment here? No comment. Okay, the next case will be with Dr. Rami. Dr. Nagar, I think you are going to the exam soon, huh?
Yes, doctor. Inshallah, on 19th of November.
November, yeah. So still you and the Dr. Rami going to the exam. So who want to do the case?
Dr. Sadiq, I'm ready to do any history case with you if no one of our colleagues would do it.
Okay, I appreciate your feeling, but we are here to help you as much as we can, to help the people who are going to the exam. The priority will be for the people who are going to the exam. So still Dr. Rami and Dr. Nagar.
The next diet.
Okay, doctor, I can do it.
I'm going to the UK, but not the next diet, the diet after that.
Okay. can continue. You know, we can continue to make 4 cases if you want, and you have the ability for that. To make all most of the people to present the case who are going to the exam.
Okay, doctor, I can do the case, please.
Okay, Dr. Nagar, this is a case of Station 5 case.
Okay.
As you are going to England, Mr. John is 40 years old.
Okay.
He has been complaining of back pain for the last 2 months for your kind care.
Okay.
You have 3 minutes to prepare yourself and to write your headlines.
Back pain, Dr. Sadr? Back pain?
Yes.
Thank you.
How old is he, Dr. Sadr?
40 years old. Back pain for the last 2 months.
Okay, doctor, shall I start?
Okay.
Okay, good morning, Mr. John.
Good morning, doctor.
My name is Dr. Nagar, the senior house officer in the medical department. Are you Mr. John, 40 years old?
Yes, doctor.
So I've received a letter from your GP stating that you've been complaining of back pain for 2 months. It is true?
Yes, doctor.
Yeah, so would you please tell me more about that?
Doctor, I've been complaining of back pain for the last 2 months, doctor, which is irritating me so much.
Yeah, I'm really sorry. So I'd like to know if this pain started gradually or suddenly in your back.
Gradually, doctor.
Okay. And is it getting more worse or is it just the same?
No, getting more worse, doctor.
Yeah, I'm sorry for that. And I'd like to know if is it more during the morning time or all through the day or night?
More at the morning, doctor.
And do you have any stiffness in your back in the morning?
Yes, doctor.
For how long?
For the last 2 months as well, doctor.
I mean, for how many minutes or hours in the morning, the stiffness?
Maybe for a few minutes, doctor, until I do some exertion, some exercise, doctor, or some movement.
So it eases with exercise or movement after you move?
Yes, doctor.
And I'd also like to know if there's anything which may trigger the pain.
Rest, doctor. Rest is triggering the pain and worsening the pain more.
Yeah. So did you hit yourself or did you have any trauma to your back?
No, doctor.
Yeah, okay. So is there any tenderness on your back as well or swelling?
No swelling, doctor.
So are there any joints affected in your body, like your hands, for example?
No other joint, doctor.
Your neck, your knees, nothing?
Yeah, I have been in the neck as well, doctor.
Yeah, I'm sorry for that. And this pain also started with the back pain, with the lower back pain, right?
Yes, doctor.
Okay. And I'd like to know if you have any skin changes at all, like any skin rash.
No, doctor.
Any nail changes?
No, doctor.
Okay. Any mouth sores or ulcers?
No.
Okay. Any change in your bowel at all?
No.
Okay. Any problems with your water work?
No.
How about your breathing? Is it okay? Do you complain any shortness of breath?
Yeah, sometimes, doctor.
Yeah, I'm sorry. Since how long?
For the last 2 months as well, doctor.
Yeah, okay. And this pain, this problem with breathing increase with the exercise?
No, doctor, not ready to exercise.
Okay. And is there any chest pain as well?
No chest pain, doctor.
Okay. Any heart racing?
No.
Okay. So I'm going to examine the patient now.
Okay.
I'm going to test the neck first. I'm going to ask the patient to stand up and to do the occiput wall distance, to see the distance.
On standing up, the patient has
then
to
lateral flexion.
posture, and the occiput wall test is limited.
Yeah. Okay. Searching for loss of lumbar lordosis, kyphosis.
Yes.
I'm also asking the patient to flex laterally and to touch his chest with his chin. Also, I'm going to test the trunk for movements on both sides.
Yes.
And I'm asking the examiner to do the modified Chopper's test.
Okay.
Then I'm going also to measure with a measurement tab. I'm going to check for the expansion for the chest. I'm going to auscultate for apical fibrosis, any fine ended inspiratory crackles on the apex or apices of the lungs. Also, I'm going to check for aortic regurg.
Okay. You want to do urine dipstick for the patient?
Hello?
Yes. You want to do urine dipstick for the patient?
Sorry that I lost connection. Sorry?
Urine dipstick, you want to do?
Urine dipstick? I didn't say urine dipstick, but I guess there is no need for urine dipstick in this patient. So I'm going to ask to continue my questions. Okay. Like if he had any, what is your job, Mr. John?
I'm a taxi driver, doctor.
Okay, and you think that this problem is affecting your job?
Sometimes, doctor, I have difficulty in turning left and right, doctor, but it's okay. I am trying to manage because this is my job and this is my life.
Yeah. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. Do you have any problems with your eyes at all?
No, doctor.
Hello?
Yeah, no, doctor.
Sorry, دكتور صادق الكونكشن عندي عمال بيقطع شوية. Okay. And with whom are you living with?
I'm living with my wife, doctor, and I have 2 kids.
Are they okay?
Yes, doctor.
Okay, and I need to know what is your concern today?
Yes, doctor. What could be the cause of my back pain, doctor?
Okay, Mr. John, I appreciate your concern. So I just want to mention first of all that you need to stop driving because this can actually affect your your health in a very bad way. The condition that you have is called ankylosing spondylitis, which is inflammation at the spines of the back, and unfortunately it can affect some other parts in your body, like your neck, for example. That's why you have some restriction of movements in this area. So I strongly suggest that you stop driving and you get to report this to the DVLA. And I'm going to refer you to the wound specialist, and also it's going to be like a multidisciplinary team with the social worker and occupational therapist as well, so that it can help you and support you financially as well.
Yes.
So how does this sound to you?
Yes, doctor. What about my sons, doctor? My children may have this disease, doctor?
Well, the good news, Mr. John, that this is not a hereditary disease, but the bad news is that there's an increased chance that that your children may develop the same problem as well. So there is not direct inheritance, but there is an increased risk of that.
Yes, doctor.
Hello?
Yes, doctor. Hello?
Hello?
Yes, Dr. Nagar.
Hello?
Yes, Dr. Nagar, are you there? Hello?
Yes, doctor.
Okay. Yes, discussion with the examiner. What's your finding here, doctor? Dr. Muhammad? I think Dr. Nagar dropped. We're trying to rejoin him. Maybe Dr. Nagar in Zambia. So there is a difficulty in the internet there. I don't know in Zambia or Zimbabwe, Dr. Muhammad Nagar.
لا هو في زامبيا يا دكتور صادق، بس شكله الانترنت عنده تعبان.
Even he signed out. Okay, after a while.
السلام عليكم دكتور صادق.
أنا دكتور أشرف، ويلكم والله.
الله يبارك فيك الله يبارك فيك الله يبارك فيك.
أنا دكتور أشرف منورنا والله. Long time you didn't join us.
الله يبارك فيك يا
A long time I didn't join you. This is how to be said here. معنا حالة Ankylosing يا دكتور أشرف to be يعني oriented with us. Yes. Ankylosing station 5. Dr. Nagar, are you there?
Yes, sorry, Dr. Sadr, I'm experiencing bad connection.
Okay, what's your finding in this case, doctor?
هو أنا بس ما سمعتش الإكزامينيشن فايندينجز لما عملت إكزامينيشن الشست.
Okay, you
في أي crackles أو في. Okay. So this young man has been experiencing back pain for 2 months with morning stiffness and back and neck pain as well. The most probable diagnosis should be ankylosing spondylitis. This man presents with lumbar lordosis, kyphosis, and loss of what?
Lumbar lordosis.
He presents with kyphosis, yes, and he's been complaining of neck and lower back stiffness as well, and shortness of breathing. The shortness of breathing could be due to aortic regurgitation, apical fibrosis, or
he's asking you what's your finding in this case. He means clinical findings, that by examination.
So, on examination, there is restricted movement of the neck, and restricted movement also of the back, decreased or limited lateral flexion, and lateral flexion of the trunk. Also, according to the finding in the chest as well.
Yeah. So you didn't mention extra 12 test. There is limited extra 12 test. So there is limitation of the neck movement in all directions. And there is a stooped posture or question mark posture with loss of lumbar lordosis and kyphoscoliosis. There is limited oxybutyl test. And you have to mention if there is any finding in auscultation of the apex of the lung and on the aortic area of the heart. And okay. Do you want to do your diagnostic for this patient, Dr. Muhammad? This patient have nephropathy?
I'm not sure.
Nephropathy because of
With the ankylosing spondylitis is...
Yeah, this patient has amyloidosis and can cause nephropathy and may have urine deficit with proteinuria or something. Okay. What could be the cause of short suppressed, doctor?
The causes of short breath in this case could be due to aortic regurgitation, could be due to apical fibrosis, apical lung fibrosis, or could be restrictive lung disease due to limited chest expansion.
Yes. Nephropathy also?
Nephropathy as well, yes.
Okay. Thank you.
Yes.
Okay, very good, Dr. Muhammad. Open discussion. Anything missed in the history from Dr. Muhammad?
Dr. Sabe, I don't want to go comment, but I want to ask a question about modified sugar test. I saw it on the internet. They make 3 points and one line 5 centimeter below and 10 centimeter above the middle point.
Yeah.
Okay?
Yes.
Is this right?
Yes.
Then we measure the difference between standing and bending.
Yes.
If the measure less than 6, it will be positive and have ankylosing spondylitis.
Yes.
Is it method right?
Yes, Dr. Magid. Actually, I read it before 5. If the difference is 5 centimeters.
Yes. Now it's no problem about this point. But about the line 5 centimeters below the point, what is the benefit of this line? I read in some sites this line is not needed in modified sugar test. We just draw one line above the point. Above the middle point.
This is the superior iliac spine. Actually, on both sides, superior iliac spine, there is a imaginary line, and there is a point to be put in this line, extending from the two superior iliac spine of the patient. Okay, actually, Dr. Magid, we don't do the exam this test. Actually, not done in the exam. We're just informing the examiner. I'd like to do a modified sugar test of this patient, and I'd like to measure this patient's chest expansion during inspiration and expiration, like Dr. Nagar said. And also, I'd like to do urine diagnostic for the patient for proteinuria. Okay.
But they don't need this one.
No, they don't do it in the exam at all. There is no time just to mention it to the exam.
Okay. Thank you. Thank you.
You're welcome, Dr. Magid. Any other comments in the history? Any systemic review of the patient Dr. Muhammad didn't cover?
I think Dr. Saleh during the examination he have also to search for any skin rashes or any nail changes to exclude other seronegative spondyloarthropathy arthropathy.
Actually, Dr. Wael, the patient denied to have a skin rash and arthropathy, other arthropathy. So, just focus the examination. You have to examine only the systemic review related to ankylosing spondylitis, not waste time in the other differential.
What about the eye examination, Dr. Sadiq?
Yeah,
Should we examine the eye?
To look to the eyes for anterior uveitis, for any redness.
Yes.
Okay.
And the aortic area, we have to listen for aortic regurg.
Yeah, he said Dr. Muhammad already about that. He made this examination. Okay, in the history, he missed, I think, to ask about any eye pain or eye problems. Did you ask Dr. Muhammad?
I asked about any problems with vision after hearing the concern.
Okay. You asked about cough. You asked about short suppressed. I agree with you, but cough for apical lung fibrosis. You asked about chest pain, racing of heart beats,
No, I haven't.
and leg swelling for aortic regurg may cause heart failure. Yes. To ask about water work. What about your water work? Amount, color, and nephrosis urine. This is for nephropathy as a complication of amyloidosis. For this patient, we have proteinuria or nephropathy. Okay. Examination of Dr. Muhammad was.
I asked generally about the water work.
Yeah. Okay.
Also, Dr. Saleh, I think for heel pain for plantar fasciitis.
Heel pain, yes.
Yes, I missed this point.
Pain,
yes.
Okay.
Yes.
So we have 6A of this patient, from above downward. This A, anterior uveitis of the eye, then A, apical lung fibrosis, another A, atrioventricular defects. So you have to ask about racing of heart piece and chest pain and all symptoms of cardiovascular symptoms. Another A is aortic regurg or mitral regurg. Then another A is amyloidosis. Another A is Achilles tendonitis. You have to ask about all of the systemic review of the patient. Dr. Muhammad also take brief history about differential diagnosis for seronegative arthritis. For psoriatic arthritis, he asked about skin rash. For enteropathic arthritis, he asked about loose motions. For reactive arthritis or Reiter syndrome, he asked about burning water work. And he took very good analysis. He took very good analysis of the complaint when this back pain started starting gradually or suddenly, coming on and off all the time with you. Any diurnal variation.
All the time with you. Any diurnal variation.
I hear my voice. And this is interrupting me actually. Any diurnal variation. Do you notice anything that improved this back pain like rest or movement? Do you notice anything that worse in this back pain like rest or movement? And any morning stiffness? And actually morning stiffness is the cornerstone here to show for you this is inflammatory cause, not traumatic cause. Dr. Muhammad also asked about in history of back pain as a differential back trauma as a differential diagnosis. Then he asked about all the systemic review of the patient regarding examination, and also he asked about social history of the patient, including driving, very important, because this patient you have to he has to inform DVLA. I advise this patient to not to stop driving. He has to inform DVLA about his condition and DVLA to take decision about this patient to continue driving or not. So that you have to inform DVLA about your condition.
Excuse me, doctor.
Yeah.
I'm sorry, but regarding this point, the patient may develop any dislocation if ever he looks to any sides while driving. So I think he has to stop driving. But anyway, I told him to go to the DVLA.
DVLA. Actually, Dr. Muhammad, for any case, even TIA or even seizures, we have to not to inform the patient, you have to stop driving. It's okay, but it's better you have to inform the DVLA about your condition, because you may be banned from driving as your condition may be dangerous in your health and or on yourself and for the public. Okay. Regarding examination, of course, you have to order the patient to stand up. You will see stopped posture or question mark posture with loss of lumbar lordosis and kyphosis, kyphoscoliosis. Occipital wall test to make the patient back to stick to the wall. Of course, the patient will be limited, and he couldn't to make his head to touch the wall. And after that, to check the pulse of the patient to see if there is any atrioventricular conduction defect. Pulse of the patient, maybe Dr. Muhammad also missed to check the pulse of the patient, regular or irregular, tachy or brady, regular on both sides or not, and also to look to the eyes of the patient for any anterior uveitis or any eye redness. Then to put the cystoscope on the apex of the patient for apical lung fibrosis, to put the cystoscope of the on the aortic area of the patient for aortic regurg, and also to check his legs for edema, for maybe heart failure secondary to his heart problems or atrioconduct for aortic regurg, and ask the patient 3 things to do. The examiner, ask the examiner, I'd like to measure this patient's chest expansion during expiration. In inspiration, I'd like to make modified sugar test for the patient. I'd like to check this patient urine dipstick for proteinuria. Okay. What's the investigation you're going to do for the patient, doctor?
I'm going to do basic investigations in the form of full blood count, urine, kidney and liver functions, urinary dipstick as well, and inflammatory markers. I'm also going to request for HLA-B27 for the patient. I'm going to do chest X-ray, echocardiography and ECG, and maybe pulmonary function tests as well.
Okay. What if the spine X-ray is not confirming the diagnosis?
If the spine X-ray is not confirming the diagnosis, then I'm going to refer the patient to an MRI.
Okay. So what's the management plan or treatment plan for the patient?
The treatment plan, first of all, non-pharmacological in the form of physiotherapy, psychological support, and teaching the patient about the disease. Then the mainstay treatment will be in the form of non-steroidal anti-inflammatories. Occasionally, if the patient is not responsive, he can be referred for, he can take monoclonal antibodies. I think adalimumab is the one for ankylosing spondylitis.
Biological treatment or
yes. Biological treatment should be the last line. Yes.
The last line. What about the exercise, doctor? Physiotherapy.
I said, doctor, the physiotherapy and non-pharmacological.
Yeah, I'm sorry. Okay. Okay, so the non-pharmacological.
No, sorry, my network is very bad.
Yeah, no problem, never mind, man. Okay, the non-pharmacological treatment in the form of patient education and counseling, psychosocial support, occupational support, and the physiotherapy, which is considered to be the cornerstone of the treatment plan. Non-pharmacological treatment in the form of NSAID. What about steroid, Dr. Muhammad? Steroid has any role here?
Sorry, doctor, ask again, please.
Steroid has any role in this case?
No, steroids, they don't have any role with ankylosing spondylitis.
Even intralesional injection of steroid?
I don't know, I'm not sure.
Okay, what about the steroid-sparing drugs like methotrexate and cyclosporin?
I think methotrexate can be used.
In the peripheral disease only, not in the central disease.
But it's not much. Yes,
Yes.
Yes, they're not affecting the back pain, the back stiffness.
Okay, so steroid-sparing drugs like methotrexate, cyclosporin can be used in the peripheral symptoms of the disease, like the peripheral, not in the central disease. And the biological treatment in the form of adalimumab or etanercept can be used as well in acute refractory cases. Thank you, Dr. Muhammad.
Thank you, Dr. Sad.
Okay, any comment here in this case, ankylosing, which is very common case in the exam, coming frequently, mainly with back pain and neck pain.
دكتور صادق هو مش الاستيرويدز ممكن الاستيرويد مش ممكن في الاكيوت اتاكس بس بتبقى فالس ستيرويد ولا لا خالص؟
لا But I remember that steroid can be used as an intralesional or local treatment by injection.
Yes, دكتور.
بس هي فوق السي مكتوبه ان هي تبقى بالس ستيرويد في الاكيوت اتاكس بس، فانا مش عارف يعني.
No, it is injection, local injection بس in peripheral.
Pulse steroid? No, I think intralesional injection of steroid. We have to review. Pulse steroid has no rule, I think, at all.
No rule, yes. As you said, Dr. Sadiq, no rule. It is given injection only in peripheral arthropathy. Local injection, peripheral arthropathy.
Yes. Okay. So if there is back pain in the exam in station 5, most probably it will be ankylosing spondylitis. Can be also psoriatic arthropathy, because psoriatic arthropathy can present in sacroiliac site. Sacroiliac, mimicking ankylosing spondylitis disease. Okay, any question here? Question, okay. So, general survey, do you want to continue for another case or not? For Dr. Rami, because Dr. Rami is going to the exam as well, he didn't take any case. Do you want to continue? Or that's enough for today?
Continue, Dr. Sadiq, no problem.
What about the others?
Continue.
I'm democratic, so that we have to make general survey.
Yes, we can take another case, please.
Yes, okay. Yes.
Other cases.
Okay, this case will be a case of history. Was Dr. Rami? Dr. Rami, are you there? Dr. Rami? Dr. Rami? Dr. Rami is in Alexandria, so that maybe he's went to the beach now.
Hello? Hello?
Dr. Rami, you're there?
Yes, Dr. Sadiq, do you hear me?
Okay. Okay, do you want a case of communication or a case of history, Dr. Rami?
As you like, Dr. Sadiq.
Okay, a case of history?
Yes.
Okay, I don't know if you took this case before or not. Mr. Ahmed is 32 years old. He has been admitted 2 months back because of upper respiratory tract infection, and he was completely cured. Two weeks later on, he has history of dry cough and wheezy chest for the last 6 weeks. Chest X-ray done for him, and it was completely normal. So again, for Dr. Ashraf, Dr. Ashraf just joined us. One case. Mr. Ahmed is 32 years old. He has been admitted 2 months back because of upper respiratory tract infection, which was completely cured. 2 weeks later on, he developed dry cough and wheezy chest for the last 6 months. Chest X-ray done for him, and it was normal. He is now in case of hypertension, for which he is receiving treatment in the form of captopril for your kind care.
Dr. Sadiq, please.
Dr. Magid, تفضل.
Dr. Sadiq, it is the first time he was admitted 2 months or 2 years?
No, 2 months
2
back
months.
he was admitted because of upper respiratory tract infection.
Okay, then he complained of 2 weeks of dry cough and wheezy chest, okay?
No, for 1.5 months, for 6 weeks. He has dry cough and wheezy chest.
Okay, thank you.
So to confirm only, the 2 months he had upper respiratory tract infection and cured in 2 weeks. And for the last 6 weeks, he had cough and wheezy chest.
Yes.
Yes, but nothing in the last 6 months.
No, just 2 months back, he was admitted because of upper respiratory tract infection, and he was completely cured.
Okay.
And later on, he developed wheezy chest and dry cough for the last 6 weeks.
Shall we start?
Okay, you can, man.
Okay. Good evening. I'm Dr. Ram from General Medical Clinic. Are you Mr. Ahmed, 32 years old?
Yes, Dr. Rami, excuse me for the question. You are on the beach in Alexandria or what?
I'm just in front of the flowers.
What?
I'm just in front of the flower.
Front of what?
Is okay now my sound?
Yes, because there is a lot of echo, the sound of the sea and the sound of the wind.
You're doing Dr. Sadiq. I am in my room with my home.
Yeah, okay, man.
Is it okay now?
Your voice is still away. Voice is still far, man.
Now?
No, still far. It was better before.
now?
It's more far now.
Dr. Sor.
Yes, okay now.
Okay. Shall we start?
We can, okay.
Okay. Good evening.
Good evening, doctor.
I'm Dr. Rami from the General Medical Clinic. Are you Mr. Ahmed, 32 years old?
Yes, doctor, I'm the one.
Okay, nice to meet you.
Nice to meet you, doctor.
Okay, I received your GP letter about your recent complaint of cough and musical chest. Can you tell me more about your condition, Mr. Ahmed?
Yes, doctor, I've been complaining of this dry cough and noisy chest, doctor, for the last 6 weeks.
Yes, I'm sorry for you, Mr. Ahmed. Okay, this dry cough, this cough is associated with any sputum production?
No phlegm, doctor.
Okay, is it stationary or increasing?
It is increasing, actually, doctor.
Does it come on and off or present all the time?
No, not all the time. Coming on and off, doctor.
What time is it? Is it its maximum intensity? In the morning or in the evening?
Actually, no diurnal variation, doctor.
No diurnal variation, but there is day-to-day variation.
Yes, doctor.
Does anything aggravate your symptom? Like exposure to certain weather, exposure to certain dust or fumes or anything?
I'm not sure about that, doctor.
Does exercise make it worse?
I'm not sure about that, doctor.
Yes. Does anything relieve your symptoms like medication or being in home?
No, actually, doctor.
Is it worse when you are at home on certain days?
No, doctor.
Okay, do you feel any chest tightness?
Sometimes, doctor, I feel this, short of breath because of this noisy chest.
Yes, I'm sorry for you, Mr. Ahmed. Okay, do you suffered from any coughing of blood?
No, doctor.
Okay, did you take any medication for this cough and wheezy chest?
Actually, I seek medical care for my GP doctor. He gave me some treatment, but it doesn't work at all.
Yes, I'm sorry for you. Okay, do you feel any acid brush or tummy pain?
No, doctor.
Do you feel any shortness of breath when lying flat?
No, doctor.
Do you feel any racing of your heartbeat or leg swelling?
No, doctor.
Okay, do you have any frothy urine or change in your water work or change in color or amount?
No, doctor.
Do you have any weakness or shaking movement of your body or headache or visual disturbance?
No, doctor.
Yes. Do you have any skin rash or joint pain?
No, doctor.
Okay. Do you have any humps or lumps or fever?
No, doctor.
Change in body temperature? Okay, Mr. Ahmed, do you have any family history of similar condition or disease running in your family?
Doctor, my father died because of a disease called cystic fibrosis in his lung.
Yes, I'm sorry for your father. Okay. Do you have do you have any disease, any chronic disease that you are taking a medication for?
I have hypertension, doctor. I'm taking medication called captopril for it.
Yes. Since what? Since when do you start to take
It's
this
for the last 2
medication?
years, doctor.
For the last 2 years. Yes. Okay. What is with work? What do you work, Mr. Ahmed?
I'm working in a coal miner,
What is your
doctor.
job? Coal miner. Yes. When did you start to in this job?
5 years back, doctor.
Okay. Does your symptoms improve when you are at home, Mr. Ahmed, away from your work?
You mean the weekends, doctor?
Yes.
The weekend is no improved, doctor. But when I went to Turkey for for a trip in Turkey, doctor, for 1 week, my symptoms improved at that time.
Okay, you told me that your drug list include only captopril for your hypertension.
Yes, doctor.
Okay, Dr. Ahmed, with whom are you living?
I'm living with my wife, doctor, and I have one child.
Okay, does your symptom affect your daily activities?
Affecting so much, doctor.
Yes, I refer you to social health workers that will help you with your condition very much. Are you financially supported?
Yes, doctor.
Okay, do you smoke, Mr. Ahmed?
Yes, doctor, I smoke 10 cigarettes per day.
Yes, I advise you to stop smoking. Did you try to stop smoking before?
I tried before, but I failed, doctor.
I am sorry for you. I will help you by referring you to a smoking cessation clinic to help you stop smoking, and this may contribute to your symptoms or aggravating it. Okay,
Yes.
do you drink alcohol?
No, doctor.
Okay, Mr. Ahmed. What is your concern, Mr. Ahmed?
Doctor, is it cancer, doctor?
Okay, Mr. Ahmed. In your condition, cancer is a far possibility. You mostly having what is called bronchial asthma. Did you ever hear about this before?
Yes, I know about this bronchial asthma, doctor.
Yes, it causes you this your symptoms in the form of your dry cough and the wheezy chest, and this is proved by that your symptoms improved when you went in a vacation away from your work and away from the dust and the pollution in the cities. So we refer you to a multidisciplinary team that will test of chest doctor and specialized nurse to put the plan of management for you. Do you have any other concern, Mr. Ahmed?
No, doctor, thank you.
Thank you. Okay, to summarize, Mr. Ahmed, you will refer to us immediately about your complaint of dry cough and wheezy chest. These symptoms you suffered for the last 6 weeks and improved when you traveled abroad to Turkey. You received the medication but with no symptoms, but was no improvement. And we will refer you to a multidisciplinary team in the form of chest doctor and specialized nurse who put the best plan of management for you. Okay. Mr. Ahmed, can you tell me what did you get from our session today?
No need, Dr. Ami. This is not communication. No need to ask about... Yeah, no need for that. Even summarization, you have to summarize the positive data before asking about the concern. No need to summarize after asking about the concern. Summarize the positive data before asking
Yes,
about
I
the
get
concern.
confused.
Yeah, asking if do you want to add anything else. Okay, thank you, Dr. Rami. Good, okay. Open discussion.
دكتور صادق السلام عليكم.
وعليكم السلام.
دكتور صادق please. Dr. Sadek, about sexual history, Dr. Sadek.
Yes.
This patient has extramarital relationship?
Yes.
Yes, he has?
No, he don't have, but Dr. Rami didn't ask.
Blood transfusion.
The risk factor
he
for
has?
HIV, you mean?
Yes, I asked about risk factor for HIV. Yes.
Yeah, no, there is no history of blood transfusion or sharing needles or surgical operations or dental procedures or tattooing or piercing.
Yes.
All of these are risk factors for HIV, which has to be asked in young male patient who's complaining of.
But he doesn't have.
He didn't ask.
During travel, he doesn't practice any extra marital sex relationship?
No, there is no history of.
He has.
And I forget to ask about atopy and any allergy and sinusitis.
Yeah, he has to ask about any childhood allergy or eczema or hay fever. All of these are risk factors or persisting, maybe risk factor for bronchial asthma in the adulthood. He has history of childhood allergic rhinitis actually.
I forget to ask.
Any pets in the house as well?
Any pets in the house and animals or birds in the house for allergic alveolitis, extrinsic allergic alveolitis, which is bird fancier disease. Maybe the patient has Burkitt's at home or has Biggles at home. Okay.
Also about asking about the renal affection as well. I'm not sure, but I'm losing the network every now and then. So maybe we need to ask about Church-Strauss syndrome as well, as the patient developed respiratory tract infection like 2 months ago.
Yeah,
so we need also to exclude Church-Strauss syndrome.
Mohammed.
Any previous bouts of wheezy chest in the past?
Yeah.
And also asking about the kidney involvement, like any leg swelling, any frothy urine, any change in the color.
Yeah, also Church-Strauss is one of the vasculitis, so you have to ask about any tummy pain, skin rash, pins and needles in the hands and the feet.
He asked, I heard him, he asked already about the skin rash.
Yeah, but I
yes, and he has also
all of them together, you know.
He has
yes.
He has also to ask Dr. Sadeh about flushing of the face for carcinoid syndrome.
Carcinoid syndrome and loose motions together with flushing to show to the examiner asking about carcinoid, yes. Okay, so discussion with
and for ACE inhibitors, any angioedema?
Angioedema, leg swelling for ACE inhibitors, okay.
Yes.
Do you think that the patient
like any swelling in the neck, which can present with...
the surrogate didn't exchange the treatment for the patient. He didn't exchange ACE inhibitor, the captopril, because captopril may worsen his condition or maybe even responsible.
Yes. You have to ask about...
Yeah, so he has
for
to...
how long he was taking captopril.
He asked about for how long, yes, but in the replying of the concern, he has to inform the surrogate to avoid all the triggers, smoking, smoking, dust and cold weather like that, all the triggers, and also to exchange the treatment he is receiving for hypertension. Okay.
And also if he's taking any recreational drugs like morphine can too cause respiratory depression.
Any recreational drugs for what?
For respiratory depression.
Yes. Yeah, he has to ask about recreational drugs as well in the history.
Yes.
Or sharing needles, recreational drugs. Okay. Okay, discussion with the examiner, Dr. Rami. What's your diagnosis and differential diagnosis, doctor?
My diagnosis include, on top of my list, bronchial asthma.
Yes.
Then maybe drug-induced like captopril, but against this, he has wheezy chest, and I do not know the captopril to cause wheezy chest.
Yeah.
Maybe he has
Occupational asthma, maybe.
Occupation, but cold will cause COPD, and about 5-year history is too short to cause chronic obstructive airway disease. So I am not put it in my differential diagnosis.
Yeah.
And it does not improve in the holidays. It will only improve when he traveled abroad.
Yes.
So it mostly, this is my only 2 differential diagnosis.
Okay. Okay. Well, it could be cystic fibrosis, doctor. This patient, his father died because of cystic fibrosis. It's an hereditary disease, doctor.
Cystic fibrosis will be symptomatic much before this, and will cause suppurative lung disease.
Yeah, suppurative lung disease, bronchiectasis with a lot of phlegm. Yeah, there's dry cough. This again
will not cause obstructive symptoms.
Yes. Okay. What investigation you gonna do for the patient, doctor?
Apart from basic investigation in the form of CBC, liver function test, renal function test, inflammatory markers, I'll do for him respiratory function test to assess his condition, and I will do a challenge test using a bronchodilator test to assess his airway responsiveness to this test, and I will do for him, repeat for him chest X-ray, but I was told that he has chest X-ray is normal.
Yeah.
And if his spirometry test was positive for bronchial asthma and his bronchiolitis test, I will do skin allergy test to detect if he is allergic to any certain trigger.
Sensitization test.
Sensitization test.
Okay, thank you, doctor.
Thank you.
Okay, open discussion. Anyone has any comment here?
I think Dr. Sadi, I have also to ask about post-nasal drip, because it is one of the non-respiratory causes of
yes, most common causes of dry cough is GERD and post-nasal drip.
Yes.
Doctor, does GERD cause wheezy chest?
No, dry cough only. But you have to ask
and
also
the captopril also dry cough on.
Yeah. Okay, so the list of our differential diagnosis here of a case of dry cough and wheezy chest that we are going to write in our notes before going to the station. And number 1 is bronchial asthma, drug-induced asthma, exercise-induced asthma, occupational asthma, and the COPD, and extrinsic allergic alveolitis. So that we have to ask about beds at home or birds at home, maybe allergic aspergillosis, carcinoid syndrome, which is a triad of bronchial asthma or wheezy chest and blushing and loose motions or diarrhea. Shark-Strauss syndrome, which is vasculitis, which can cause tummy pain, loss of weight, pins and needles, peripheral neuropathy, skin rash, and also renal impairment. So you have to ask about the amount of the water work, amount, color, and fluid urine.
I asked it for water work and its color and fluid urine.
Yeah, we just.
But Dr. Sadiq, yes, sorry for interruption. But if in the case of history, okay, my scheme is to ask about the complaint and the associated symptoms, then the differential diagnosis, then systemic review.
Yeah.
okay?
Yeah.
But my systemic review almost covered all the differential diagnosis.
It's so difficult, Dr. Rami, that the systemic review. You mean that? I didn't get your point actually. Do you mean that you are going to make systemic review, all the systemic review, regardless of the differential diagnosis? The systemic review is going to cover all the differential?
Yes.
No, Dr. Rami, actually, because if you went like that, so that the examiner will consider you a text doctor. You are just only reviewing all the systemic review of the patient regardless of the differential diagnosis. You have to make a differential diagnosis in your mind, and you have to ask about the symptoms of every differential diagnosis alone, to show the examiner that you are making a list of differential diagnoses. If you went like a systemic review only for the patient blindly without making a good list of differential diagnoses, even if you reach a diagnosis, I think the examiner will decrease your marks, because your approach like that will not impress the examiner actually.
Okay.
So for bronchial asthma, I have how to ask about bronchial asthma. You have any history? طبعا you asked before about the persisting symptoms or triggering factors like dust, pollens, pits, smokes, cold weather, perfumes. All of these are, persisting factors or triggering of bronchial asthma. Also for bronchial asthma, you have to ask about childhood allergic rhinitis or childhood allergy or eczema or hay fever. All of these can give you data that this patient have these symptoms in childhood, so that he is more predisposed to have bronchial asthma in adulthood. Exercise also, for exercise induced asthma, you have to ask about the patient job for occupational asthma. And you have to ask about if the symptoms subsided or improved in the weekends for occupational asthma. And then for COPD, you have to ask about smoking, how many cigarettes the patient is receiving, and for how long. And then for extrinsic allergic alveolitis, you have to ask about birds at home, like barkets and bygons, for bird fancier disease as one of the extrinsic allergic alveolitis diseases. And for carcinoid, you have to ask about any history of flushing or loose motions. And for Sjögren-Strauss syndrome, you have to ask about symptoms of vasculitis, like skin rash, pains and needs in the foot and hands, loss of weight, tummy pain. What about your water work, amount, color, and any frozen urine? All of these are the differential diagnosis of dry cough and wheezy chest. Also, you have to ask about the GERD symptoms like acid brush sensation or heartburn and post-nasal drip by name. These are the most common causes of dry cough at all, GERD and post-nasal drip. And then to take also infection, you can put infection as one of the differential diagnoses, especially HIV infection and TB, so that you have to ask about fever also, and loss of weight, and the risk factors for TB, contact with TB patient, and the risk factor for HIV infection, extramarital relationship, surgical operation, dental procedures, blood transfusion, needle shearing, tattooing, piercing. And then to take systemic review of the patient as usual, regardless the patient symptoms, all the systemic review, general symptoms, cardiovascular symptoms. Also, cardiac asthma is one of the differential diagnoses, so that you have to ask about chest pain, racing of heart beats, and leg swelling. Then the systemic review of the patient. Don't forget to tell the patient before taking the history, I'm going to write some notes. Be sure that it will be completely confidential, and I will be completely with you. This is for the patient welfare. After review, making the patient systemic review of the patient regarding the cardiovascular, GIT, genitourinary, musculoskeletal, traveling history, family history, drug list of the patient, medical history, family history, and drug list of the patient. Don't forget social history. Do summarization about the positive data. Summarize the positive data for the patient, and ask the patient, do you want to add anything else? And then ask about the concern. So after taking history from you, we have to examine you firstly. Most probably you have bronchial asthma. Is it cancer, doctor? It is unlikely of your condition to have cancer, but we have to exclude as well. Most probably you have bronchial asthma. So what we are going to do for you is to do for you first a blood test and what's called the blue test to confirm our diagnosis and to exclude the others. Then we are going to refer you to multidisciplinary team from chest doctor and specialized nurse, social worker to give you the full care and management plan. You have to avoid all the triggers like dust, pollens, bits, and cold weather, smokes at all. And you have also, and the smoking, you have to stop smoking also because it can worsen your condition and trigger your symptoms. And we can refer you to smoking cessation clinic for that. And also we are going to exchange the treatment you are receiving for hypertension because it can worsen your condition with another treatment which is more safe in your case. Of course, Dr. He's giving you a lot of positive data here, like this patient, his father has cystic fibrosis to make you confused, and that he's working as a coal miner to make you confused also. Maybe his coal miner is the underlying cause of his symptoms, and also he's a smoker for a long time. He's a smoker for a long time, so that he may have COPD. But actually, he's giving you another positive data like chest X-ray is normal. Normal chest X-ray excludes COPD, exclude bronchiectasis for his condition. Cystic fibrosis for the patient will come with bronchiectasis. Actually, will make bronchiectasis, and this again is the symptoms of the patient of dry cough and wheezy chest. So this patient has history of allergic rhinitis in childhood. He has normal chest X-ray. He has his symptoms improved when he was in a journey to Turkey away from the triggering factors. So most probably this patient has bronchial asthma. We will put bronchial asthma at the first differential. Can be drug-induced asthma in the second differential. Third differential, occupational asthma, but again is that the patient's symptoms not improved in the weekends, and the coal mining don't cause, actually, it causes COPD, but again is that also the normal chest X-ray. Okay, any question in this case?
Dr. Saad, I have to tell the patient to ask him about if have to be admitted or not, or no need at the end of the case.
No need, because this patient has a chronic cough actually for 6 weeks, so there is no indication for admission in this case.
No, yeah. Do I have to tell him that he will not? There is no need for his admission?
Yeah. You can tell him that we are going to give you, or treat you, or manage you in outpatient clinic. It's okay, yani.
Yes.
Yeah.
Okay.
Okay. Any other question in this case? Okay, no more questions. Pleased to meet you all today. I have the pleasure to meet you all, and thank you. Thank you for the candidates who attended for the first time. Inshallah, we try to make our courses frequent, or our sessions frequently, inshallah.
شكرا.
Thank you all.
شكرا. Thank you.
See you later on, inshallah.
السلام عليكم. Thank you. السلام عليكم.